Vanakkam, good morning. In this video, we are going to discuss about the diffusion of gases across the respiratory membrane. Alveolo-capillary membrane or respiratory membrane, it has the inner surfactant layer. It covers the thin fluid layer and alveolar epithelium. It is supported by the basement membrane of the alveolar epithelium and thin interstitial space and basement membrane for the capillary endothelium and endothelium layer and plasma RBC membrane. Inside the RBC hemoglobin is present. So the gases oxygen is transported from the alveoli to the RBC bind with the hemoglobin. Carbon dioxide is moved from the plasma to the alveoli. Factors affecting diffusion of the gases are thickness of the respiratory membrane. The normal thickness is 0.2 to 0.5 micrometer. So thickness increases in the pulmonary edema. The surface area of the respiratory membrane also important for the diffusion of the gases. The surface area is decreases in conditions like collapse of the alveoli in emphysema, and it is also dependent on the solubility of the gases in water and molecular weight of the gases. So, molecular weight of the gases and diffusion coefficient is more for the carbon dioxide is compared to the oxygen, 20 times more than the oxygen. Pressure gradient also play the important role in the diffusion of the gases. The ventilation and perfusion ratio, ventilation gradient and perfusion gradient is also play the important role in the diffusion of the gases. Diffusion of the oxygen at lung level, the alveolar pivot is 104 mm mercury. At the pulmonary capillary, it is pressure gradient is more than 64 mm mercury. So the oxygen is transported from the alveolar to the pulmonary capillary through respiratory membrane. The alveolar PCO2 is 40 mm mercury. At the pulmonary capillary level, it is 45 mm mercury. So it is the pressure gradient is more in the capillary and diffusion capacity also more for the carbon dioxide. It easily diffuse through the respiratory membrane, reaches the alveoli to the environment. So pressure gradient is 5 mm mercury from the pulmonary capillary to alveoli. The diffusion capacity of the lung is volume of the gas that diffuses through the respiratory membrane each minute when there is the pressure gradient is the 1 mm mercury. It is calculated by this formula. The pressure gradient is multiplied by the solubility of the gas and the area of the respiratory membrane divided by the molecular weight and thickness of the respiratory membrane. The diffusion capacity of the oxygen at rest is 21 ml per minute millimeter mercury. During the exercise, 3 times increase 65 ml per minute millimeter mercury. Diffusion capacity of the carbon dioxide is 20 times more than the oxygen. At rest, 400 ml per minute millimeter mercury. During the exercise, 1200 ml per minute millimeter mercury. Diffusion of the oxygen at tissue level. At the tissue level, carbon PO2 is 95 mm mercury. The tissue PO2 is 40 mm mercury. So the pressure gradient is more from the capillary to the tissue. So the 5 ml of the O2 is delivered to the tissue per 100 ml. 100 ml. Okay. So in the 5 liter of the blood, it is around 250 ml per minute is delivered to the tissue. The diffusion of the carbon dioxide. At tissue level the carbon dioxide pressure is 45 millimeter mercury. At the capillary level it is 40 millimeter mercury. Due to the pressure gradient, 4 ml is delivered to the tissue to capillary. 4 ml amount per 100 ml. The cardiac output 5000 ml, so it is around 200 ml per minute is delivered from the tissue to the capillary at the tissue level, carbon dioxide. Respiratory quotient is the ratio between the carbon dioxide output and oxygen consumption in the body per minute. The respiratory quotient is 0.8. It is dependent on the type of food consumed. The carbohydrate respiratory quotient is 1, fat it is 0.7, protein 0.8, mixed diet 0.8. During the exercise, in spite of the inadequate oxygen, more amount of the carbon dioxide produced due to the tissue metabolic activity. So respiratory quotient is more during the exercise. Thank you for watching this video. If you like this video, press the like button and share your friends. Those who are not subscribed this channel, please subscribe. These videos briefly discuss the physiology topics. You must read the physiology textbooks. Thank you once again.